Sprains, strains, muscle pain, no one wants to experience any of them, but injuries can happen even while enjoying fun summer games and activities, and many of these injuries can be prevented. So to talk about how to prevent common summer sports injuries and keep you healthy while staying active this summer with us today is Dr. Dana Brooks with Cone Health OrthoCare Greensboro. Thank you so much for joining us today.
Of course. Yeah, thanks for having me.
Absolutely. All right, we're going to start here. What are the most common summer sports injuries you could see that really could be prevented?
Sure. Yeah. Yeah, we see a lot of them here working at orthopedic practice, but what I'd say are most common are things like, tennis elbow or leg strains or tears, so things like the quadricep tendon or hamstring strains. I see a fair amount of overuse injuries, so things like Achilles tendonitis or plantar fasciitis, shin splints. And then depending kind of on the patient population, the age, the activity level, we also see some more traumatic things like ACL tears, meniscal tears, rotator cuff injuries.
And injuries can even happen while tossing the ball in the backyard with the kids or, casual game of beach volleyball, but not formal competitive sports. So kind of talk about that.
Yeah, you hit it on the head for sure. I mean, a lot of times we'll see patients come into the office and yeah, the story isn't great, right? It's not a big sporting event. It's, hey, I was out on the beach and I rolled the ankle, or, I stepped in a pothole. And a lot of times I do think that's when injuries come about for a few reasons. If we're getting an activity, we're usually preparing ourselves, but sometimes we're just out in everyday life where, we're not stretching, we're not doing a proper warm up. So those are things to think about. A lot of times it's on uneven terrain or an unfamiliar terrain. So we've seen people, playing catch with their son or daughter out in the lawn and they step in a pothole. And then a lot of times, if you're not planning to play a sport, you're just picking it up, that day. A lot of times we'll have improper shoe wear, so people wearing sandals or heels or not the right equipment that they're using. So all those certainly play a role in some injuries that can come about.
Absolutely. And what are some practical steps people can take to prevent injuries before they even happen?
Yeah, that's the magic, right? So I'll try
Right.
a few good things. Obviously, we can't prevent them all, but definitely some steps that everyone can take that will certainly reduce their risk on a daily basis. So things like a proper warm up. So we're kind of moving away from sit and reach, just stretch. That's all you need. We're looking more at a dynamic warm up. So something that's getting your heart rate up a little bit. So some jumping jacks, running in place. Something to get the body and the muscles warmed up and loose. Another big one, especially in the heart of North Carolina, right, in the summer times, is just staying hydrated. It gets hot, and when our bodies aren't appropriately resuscitated with fluid and we're not drinking water, that can certainly increase your risk for a lot of different injuries. And the other thing I say too is, not just when you're doing the activity, but there's definitely a place for regular stretching, things like yoga, incorporating strength training, whether that's at home or at the gym. Those are sort of things that are going to build up your muscles endurance so that you're better able to participate in those activities that you want to do.
Oh.
Probably the last thing that I say too is just listening to your body, right? You probably know your body better than even we do at times. So if your body's telling you you need to rest or you're hurting, just listening to that is definitely important.
Very much so key. Well, doing much too soon, we have all done it, and then we feel it later. I'm so guilty of that. So are there signs we need to be aware of that would indicate it's really time that you should just take a break?
Yeah. Yes. Happened from experience as well too. So definitely. But yeah, I think doing too much too soon can certainly increase that risk. We know a few things. So everyone's overdone it a little bit and had maybe the whole body hurts or a certain area will be sore for a little bit. I say it's normal to have some of that. So for a day, 2 days, maybe 3 days at the most, if you're feeling a little sore, that can certainly happen. There's actually a condition called delayed onset muscle soreness where it's normal to have some of that soreness and a little bit of muscle fatigue. That's just the muscle being used. But I would say after it's been a few days, your pain still isn't getting back to your baseline, or if you're having pain while you're doing an activity. So all of us have done some things and we're a little sore the next day, but if you're consistently having pain when you are going to play tennis or you're playing golf or you're playing basketball, that's probably a good idea to say, hey, why don't I go see my local sports medicine or orthopedic physician and at least see them? Is this normal or is there something I should be doing differently?
And what could happen if we don't?
Yeah, so what could happen if you don't is if you aren't already injured, you can get injured, or if you're having an injury, it can certainly progress to a worse injury. And so I think just that's the point that you should be aware of if you're listening to your body and it's hurting you. You're certainly at a much higher risk of just re-injuring that or going on further. I've had patients come into my office before that said, well, I could still walk a little bit. It hurts, so I didn't think it was possible to have something broken. And we'll get an X-ray or get an image, and we see something broken. So we're trying to prevent that, right? Because all of us as physicians, we're trying to get you back to doing what you want to do safe.
Are there conditions that may pose higher injury risk during the summer that we really should be aware of?
Yeah, good question. Alluded to it just a little bit earlier, but extremes of temperature. So when it's hot out there, when it's in the middle of summer here in North Carolina, it's 90 degrees. That's certainly going to increase your risk for dehydration and just pull water from the tissues. So really got to be careful when it's hot. And hydrating starts not just when you're playing that sport, but even the day before or a few hours beforehand. So that's something to be aware of. The other
Okay.
thing too is just uneven terrain on unfamiliar settings. So just making sure you're comfortable with where you're playing, or you've checked that out for potholes, for loose branches, things like that. And then another thing that I would say is, especially speaking to the kids and the parents that are out there, conditions that we see with certain younger athletes are overuse injuries. So I see a lot of kids in my practice who are only playing one sport from the time they're age 8, right? Because they're trying to go to the NBA, they're trying to go to the NFL. And so one thing that I just say for parents and kids, it is good for your kid to play a multitude of sports early on, even if one's their favorite. Playing a handful of them to change kind of their training throughout the year is something that's going to be good for them in the long run and help prevent injuries for sure.
Yeah, absolutely. And let's break down a couple of fun summer sports activities and what we can do to avoid injuries. And I'm sure top of mind is like pickleball and then golf. So let's start with pickleball first.
Yeah, pickleball, it's definitely blowing up here the last few years. We see a lot of pickleballers in our office that we're trying to get back onto the court. That one, I would say definitely things we talked about, a proper warm up, I think is important for that. Another thing, it's a lot of agility based and kind of smaller movements. So making sure the ankles have good mobility and you're doing some prehab or rehab for the ankles as well. That's something I think would be definitely important for pickleball.
Oh,
For golf, that's a great one too, right? You think it's not that dangerous, but you'll be surprised. You definitely get some injuries
oh
with golf.
yeah.
One thing I would say with golf is there's a lot of torque and there's a lot of pressure you put on your body when you're swinging. And so flexibility and mobility is really important in something like golf. So whether that's a daily rhythm you do or certainly before you're golfing, instead of just getting the heart rate up, this is one that you're really going to be working on your range of motion and stretching, especially of the shoulders, the back, and the hips. So that's something that can certainly be helpful for that.
What's a third sport that comes to mind when we talk about summer? I don't know, swimming. What do you think?
Yeah, swimming is important. Running, we don't think
Mm.
about that as a sport because sometimes we just do that for activity. But it's great. Running is good. We get outside, we get some sunshine and some vitamin D, and we're moving our muscles. One thing I'd say for running is, again, that dynamic warm up beforehand. And I think too, just being aware of your training regimen. We talk about something like the rule of tens or the rule of 10% being if you're starting out running, per week, you don't want to go up more than 10% or even really down 10%. So you want to kind of keep it consistent. And as you're running, even if you're starting now, you've been doing it for a year now, you want to slowly increase your pace as well as your distance. So something to be mindful of.
All right, and we got about like 90 seconds. So unfortunately, injuries happen, but what are some at-home treatments people can certainly follow?
Yeah. Yeah, so people have probably heard about the RICE mnemonic, right? Rest, ice, compression, elevation. So if you've had an acute injury, those are something that's good to do. Icing, usually if you're having swelling in the first 48 hours is good. I like then alternating ice and heat because ice can kind of stop your swelling. Heating kind of brings in some new blood flow to kind of get tissues and everything moving. So that's certainly something that is certainly helpful. If your doctor's okay with you taking some Tylenol or some ibuprofen, that's fine to do for a few days to kind of help yourself. Staying stretching, staying mobile. So whether that's during an injury and afterward, those are certain things that you can do at home that hopefully in a few days we get you back out there on the court or back on the course. But again, if in a few days that's not making, not helping, that's probably when it's a good idea to see your local doctor.
All right, I like all of that. Thank you so much for your wonderful advice. This is a great conversation, and maybe you missed the entire thing. You can find our whole conversation on our website, WFMYnews2.com.